Kat Perkins from The Voice is filling in for Elizabeth today. It's good to be with you, Kat.
Thank you.
All right, here's a hypothetical. If somebody told you that you could move fat from one area of your body and then use it to enhance another part, would you just say, sign me up, please?
Yes, yes.
Well, you know what? Not too good to be true. It's a real thing, and it's a procedure that a Minneapolis mom says actually increased the size of her breast. TCL reporter Kelly Hansen has her story in today's Be Well with TCL.
I would joke and say it's a negative A. That's what I called him.
Melanie Schmidt wanted what a lot of women want, larger breasts.
I mean, I didn't want big, huge, fake breasts. I didn't want that. I just wanted to be proportion. I wanted it to make sense.
But she didn't want breast implants. For years she thought about it, but then discovered what she calls a much better and safer alternative.
You had what a lot of women want done. You had a little extra fat taken from one area of the body and put where?
In my breasts.
I didn't think this was possible.
Neither did I. And then once I found out about it, I was like, yes, please, sign me up.
She found this option at Kovanda Plastic Surgery in Edina.
This is a great option for women that just want a natural increase in size, only a moderate increase in size, and a very natural shape.
But for the past 5 years, fat transfer has proven to be a great option for many women.
And it's taking fat from areas of the body that patients don't want it anymore. We purify the fat, we centrifuge it, we get just the actual fat cells out. We get rid of all the oil and debris, and then the fat is injected in the breast to selectively shape and enhance.
And it can be subtle.
Not very many people know that you've done this.
I think 3 do. That's about it.
Not anymore.
Melanie's before and after photos show a natural look, and unlike implants, because it's her own fat, the body won't reject it. She went from an A cup to a C cup, and Melanie says it's something she wished she would have done years ago.
I didn't want the risk of infection. I didn't want to have them redone. And so now it's all me.
So recovery here takes about 6 weeks, and Dr. Kovanda says most patients are off of their pain medication within 3 or 4 days, and also scarring very minimal because they're only using needles to inject the fat. You're probably wondering, how much does this cost? The average cost of the procedure is under $7,000. Wow. You can mention Twin Cities Live when you schedule your free consultation at Kovanda Plastic Surgery, and you'll be offered a complimentary signature facial. We've posted their contact information at twincitieslive.com. There you'll also find before and after photos of patients who have had the fat transfer procedure. A big thanks to Kovanda Plastic Surgery for sponsoring the show. Boy, did that get our Twin Cities Live office talking last week. My goodness. Hey, up next,